Check 1 2. Check, check, check.
Good morning, ladies and gentlemen. Good morning. Let's try that again. Good morning, ladies and gentlemen. There we go. There we go. Family and friends, co-workers and cohorts. Just wanted to let you all know that we will begin shortly. So go ahead and finish getting your refreshments. Come on in. We'll begin shortly. Thank you.
Check, 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 check. Check 1 2. Check 1 2.
Good morning, ladies and gentlemen. Good morning, ladies and gentlemen. It is my esteemed pleasure to officially welcome you to this year's, the 9th annual Top Blacks in Healthcare Thought Leadership Summit this morning. So with that, we want to go ahead and get started. We've got some incredible panels today where we'll learn so much and just get a chance to soak in so much today. So without further ado, I'd like to introduce the CEO of BlackDoctor.org, Mr. Reggie Ware.
Good morning, everyone, and welcome. Yep. You know, it's really exciting to be here today. This is our 9th year, as Derek stated. So it's our 19th year, BlackDoctor.org. By the way, we affectionately call ourselves BDO. So if you're up on stage and you don't want to say BlackDoctor.org, you can just say BDO and you're good. But it's our 19th year, BDO, our 9th year doing thought leadership here. And so next year is going to be our 20th year, 9th year with the gala of Top Blacks in Healthcare. So next year is going to be 20 and 10. And I got to tell you, we're already planning what we're going to do next year, because we're going to bring all of our honorees back to one location. And, you know, it's an amazing thing, because each year for Top Blacks in Healthcare, we recognize some very, very distinguished individuals. We have a few of them in the room right now. As a matter of fact, I know Dr. Hildreth is here. Dr. Hildreth, can you stand? One of our 2024 honorees. Dr. Daryl Gray is here. Where is he? There he is, right here. Yeah, with Well Point. Yeah. And I know we have Ponda from Amgen, last year's honoree. Ponda, can you stand? Yeah. So these are just a few of the distinguished people that will serve on panels, that'll be on panels today and so forth. But again, for us, you know, BlackDoctor.org, you know, we see ourselves as a true platform, a platform that allows brilliant minds and passionate hearts to come together, and let's talk about how do we improve the health of our family members. Because it's the Black community, but like someone told me the other day, them are peoples, you know, them are peoples, you know. And, you know, and so we're sort of trailblazing the entire healthcare landscape, because now with health equity turning the corner and becoming front and center, you know, we have a number of mainstream websites, Everyday Health and WebMD, and if you look on their website, they have so many pictures of Black folks on there. I'm like, what's going on, right? But they see the business side of it, capturing the revenue, but what they don't understand is that when you grab money from organizations that are there to help the community, while your intent may not be to hurt, is hurtful, because the people aren't getting the help that they need, right? And companies like that can never reach our audience, because, you know, we want to hear from ourselves. We want to tell our own stories. We want to hear from people that look like us, that's passionate, that when you see them talk, you know, okay, yeah, this person has my back, right? And so today, as we do our panel, a number of panels and so forth, you're going to hear some really insightful messaging, thoughts, and what we want to take away from it is things that we can do to become better at gaining trust, earning trust within our community. And last thing I'll say before I get off, usually somebody's here doing this, but nobody's doing that right now, so I'm lost right now. But I will say this. So we did a study. We do polls and surveys all the time, and we did a study, and we asked our audience. First of all, we asked them, do you trust pharma, healthcare, and so forth? And it was a really big number. 85% said they didn't trust. And then we did another study, and we said, if BDO told you which pharma companies to trust, would you believe us? 80% said yes. 80%, right? And we polled, I don't know, maybe a couple thousand people with this. And so for us, when we get information like that, we say, okay, so they'll believe us if we say it. But the key is, how do you say it, right? How do you get, you have companies like Amgen, for example, one of our sponsors here, that step up to the plate every time we need something, right? So how do we get our audience to trust Amgen? One is to have them highly visible, right, when we're doing events like this, but more importantly, it's when you bring the people, the individuals behind the company, pull back the curtain, and you can see their passion and love and desire to get people healthy and well and so forth, right? That's how you get people to trust. When they can see the individuals like you all here that are here to help share insights and let's figure out a way to get the Black community healthy, because at the end of the day, that's how we define success, right? And the lives we save, the suffering that we're able to alleviate, and getting people on the right track to make all the right decisions when it comes to their health and their happiness. So without further ado, I'm going to step aside and let the first panel start. So why don't you guys come up to the podium or up to the stage. I think we're good. Thank you.
Testing.
Good morning, testing.
My mic works, check one.
Good morning, all, and thank you for joining us here today. Our hearts are in trouble, and cardiovascular disease is a global public health crisis, and it's probably deliberate that we start today's panel discussion with this particular topic. In the U.S., heart attacks and strokes are occurring every 40 seconds, and their impact on the Black community is worse. In the U.S. alone, Black Americans are 54% more likely than white Americans to die of heart disease. I'm Amanda Beasley, my pronouns are she, her, and I work at Amgen as a director in representation and clinical research, known as RISE, improving clinical trial diversity and proportional representation within clinical research by addressing systemic barriers that deter people from participating. I work internally to develop processes to embed in the DNA at Amgen, but I also work externally to collaborate with partners like BDO that are already trusted in their community and doing excellent work. My dad is a survivor of 2 heart attacks, 2 multi-bypass surgeries, and is a 2-time recipient of kidney transplant. That was all due to uncontrolled high blood pressure. My mom has survived 3 aortic aneurysm surgeries, and they are both my why. They're my why to know my numbers so I can do what I can ahead of that. They're my why to make sure everyone has access to excellent health care because they're both still alive and healthy today. And they're my why to be sure that we are confident at Amgen that the drugs we make are able to treat everyone that has that disease. So I want to thank our esteemed panelists here for leading us through a fantastic conversation about how to truly have a heart for our community. First, I would like to take a moment to introduce you to Tara Robinson, CEO and co-founder of Black Heart Association, an organization dedicated to promoting heart health and equity. Besides being a leader, she's a remarkable individual who has triumphed over adversity, including 3 heart attacks of her own. Her passion is for advocating for better heart health awareness and care, especially within the Black community. Thank you, Tara. We look forward to hearing more about your journey, but in one word or phrase, what's the main thing you would like the audience to take away from our panel today?
I would like the audience to take away that if you don't have one foot in the community, you can't speak for it.
Beautiful, thank you. Next on the panel, we have family physician and past president of the American Academy of Family Physicians, Dr. Warren Jones. We often see Dr. Jones as a moderator, so we're really excited to hear his side today. Dr. Jones founded and established the Mississippi Institute for Improvement of Geographic Minority Health and Health Disparities at the University of Mississippi Medical Center. His passion comes from his promise to himself and a close friend to become a doctor after a terrible accident, and from losing his daughter to cardiovascular disease in her 40s. Dr. Jones has been recognized for his pioneering efforts in health, as well as a distinguished educator. Thank you, Dr. Jones, for being with us today. Would you please help us level set our conversation today by sharing your biggest concern about cardiovascular disease in the Black population?
Well, thank you very much for the opportunity to be here. And as you said those things, I was looking around to see who you might be talking about. But my biggest concern is that, as the Association of Black Cardiologists used to say, and I still do, that children should know their grandparents. And far too often, we have situations where Black children, their grandparents don't live long enough to give them that multi-generational support. And I'd like for us to change that, starting today.
Thank you so much. And finally, we have our esteemed Dr. Ponda Motsepe-Ditshego, Amgen Vice President and Therapeutic Area Head of Global Medical Inflammation, and a member of our Amgen Foundation Board of Directors. And she's going to build upon Dr. Jones's thoughts in measuring success in the community-based approach to heart health. Thank you for being here, Ponda. Would you please offer a brief overview about your background and Amgen's commitment to improving our enrollment over the next 5 years and how RISE is working to do that?
Sure, thank you, and good day, everybody. Thanks. It's really a wonderful opportunity to be here with my esteemed panelists. Amanda, I just want to take a step back and say that we've come a long way in terms of addressing all of the different health inequities, especially in cardiovascular disease, but we still have a lot more work to do. I've had the opportunity in my 24 years of being in this industry, working across 3 continents, 4 countries, namely South Africa, the UK, Canada, and now in the US. And it saddens me that there's one consistent thing I continue to see, which is the inequities that happen to underserved communities. And it's days like this and platforms like this that really provide us an opportunity to talk about it and really, really address it and come out with actionable things that we can do. So, I'm representing Amgen, but I'm also representing this village. I always say it takes a village in order for us to really move the needle on this topic. So there's a lot of things that we've been doing over the years, and I would just say from an Amgen perspective, we started this team called RISE, which Amanda has defined. But the thinking behind that actually happened as far back as 2016. We had a group of individuals that were very passionate about this topic, and through our Amgen ABN, which stands for Amgen Black Employee Network, it's one of our ERGs, like-minded people got together and they said, hey, let's address this. So, when I talk about the efforts and the work that we want to do and have started doing at RISE, it's really 3 things. It's a beautiful story of how an ERG can have a huge impact on the business and really help the business move the needle. It's not just about getting together and having lunches and, addressing many things. It's really about the business impact, and we've seen that at Amgen. The second story I tell about how RISE came about is the importance of sponsorship spine. We had support right from our chairman and CEO, our executive vice president of R&D, to say we will and we are going to address this, and we will give you the resources to do so. And then the last thing I'll say is that it's also provided us with opportunities for talent, scouting, for career development within our team members at Amgen. So really, really proud of that. But there's a lot that we want to do at RISE. There's a lot of things, and I won't go through all of them, otherwise I won't stop talking, and we need to get on with the next questions. But the main thing is that we want to make sure that we really are addressing how we design clinical trials, how we execute clinical trials, how do we identify our investigators. We know that we want investigators that look like the participants in order for them to be willing to participate and, to overcome many, many things, including mistrust and many other barriers that we all know about. So I'll stop there, and then I'll probably talk a little bit more later.
Thank you so much, Ponda. All right, Dr. Jones, would you be willing to share your story about the accident shortly after your child was born, as well as your daughter's story?
Back in 1971, as I was finishing college, my young daughter was born while I was a senior in college, and I was married then. And I was also drafted right out of college to go into the Army. So I was bringing my wife and daughter back to her home in Mobile to stay with her parents while I went back for my induction physical. And on the way back, driving back, a car jayed out and hit my car blindside. And I turned over 3 times and ended up in a ditch. And I was able to get out of the car, take pictures, and walk away. And I thought to myself, I must be here for a purpose, because I've seen lesser accidents where I've had to declare people dead. And that was a part of that's a part of my why, and a part of why I do what I do. It's kind of, when you get an experience where you feel you're seeing your end, it impacts you. And the question is, how do we get people to see that they're on potentially a road to their end that they can avoid? And that's a part of what I try to commit myself to do. I would hope that as leaders, we find a way to help the people we serve to identify the road they're on. Are they checking their numbers and knowing their numbers? Are they willing to talk openly with the members in their family about what's going on? Are they willing to seek help and welcome that help? And are they willing to welcome people in the community that are honestly interested in helping and allowing them to participate in the process? So I know it's more than what I was supposed to say, but I did want to share with you that I believe that we can make a difference, we will make a difference, and it begins with us right now.
Thank you, Dr. Jones. All right, to build on our sensitive topic, Tara, would you be willing to elaborate on your story and how it guided you to where you are today?
Sure. First of all, I feel like I need a church mother to hand me a cover right now. Any mothers in the house, I don't know.
Pressure.
But yeah, I'm over here like, okay. So much like Dr. Jones, I saw my end. I wasn't expecting it. It completely caught me off guard. I thought I was healthy. I'm always in touch with the healthcare system just from being a veteran, we're constantly getting our physicals done, so it was natural for me to keep that up outside of the Army, and so I did. And so I'm seeing my doctor when I need to every year, physical, blah, blah, blah. I'm doing that. I'm fully insured. I'm educated. I have a decent job. I'm a school counselor, and so I'm just doing life. And so at 39, who would have thought my left arm would go numb and my neck would start to bother me around November of 2013. And I just chalked it off. I don't know many doctors in here, so I'm going to say it anyway. I started to self-diagnose, and I said, maybe I sleep on this left side too much, or, tweaked it at a gym. Girl, see, I'm not by myself. I know. See. And so, then my feet turned dark in December, and I talked to my sister, because we all got those doctors in our family that are really not doctors, but I have one of those too. And so in January, she was like, you need to get to the doctor. And so in January is my physical every year. I never miss. So I went to my doctor, and I was like, hey, this is bothering me, my left arm and my neck. And I remember her being in a rush because she was getting ready to go on vacation. So I get it. I'm excited. I get excited too. So we were having this conversation, and she's like, well, all your numbers are fine. You don't have I didn't have blood pressure, cholesterol issues, diabetes, none of that. She said, maybe you're stressed. I said, yeah, I could be stressed. And so she never connected, though, the stress to my heart health. And so I left her thinking, hey, and I believe everything my doctor tells me. I come from, and my mom and grandmother are still that way, what the doctor says is Bible. And so I left her thinking, hey, I'm just stressed out. Every time I feel this happen, I need to do something to get the stressor off of me. And so from January to April, thank God for keeping me really from November to April. April 10th, I would wake up and I had all the textbook symptoms of a heart attack. Went to the nearest ER. By the time I arrived, I feel better. Everything is fine as far as the test they took that night. And I remember the doctor coming in, and he said, well, you're too young to be having a heart attack. And I agreed with him. I am too young. What in the heck are you talking about? And so he was like, well, we couldn't find anything, so just follow up with your primary care. And I don't know how many of you ever have to see your own primary care doctor, but I was like, who can get in with their primary care right away? Okay. So I before I could call the doctor, y'all, I went to work, and I'm in my classroom because at that time I'm a teacher, and I fall to my knees in front of my students at 9 a.m. I just left the ER at 6 a.m. at work because I felt better. And at 9 a.m., I'm on my knees in front of my students. And so I said, it's happening again. My assistant came in and said, what's happened? I was like, I don't know. I just left the hospital. They don't know. I don't know. And so they call 911. The fire department gets there, do an EKG. And again, they can't find anything. It becomes my choice if I want to go to the emergency room. I say, yeah, who wants to go there? But my husband's like, get your butt back to that emergency room. Thank God for husbands, right? And so I went ahead and went back, and then I saw a cardiologist, and me and her, I'm running it down to her, all the things. And she says, well, what you're saying is like, again, you're having a heart attack, but we can't find anything. And then she's like, oh, then she went into the insurance wouldn't cover for me to stay. And me not knowing all the ins and outs of that system at that time, because now I know better. But I was like, well, I know something is wrong, and I just need whatever it is to happen here. And so she said, we'll do a heart enzyme, and she goes over what that means. And she said, she comes back and she says, well, it's so slightly elevated, it's not enough for us to keep you. I said, but it is off. And you said, if it's off, that means something's going on with my heart. So that finally convinced her to let me stay. I stay overnight. I'm released at 11. At 4 o'clock, I'm going back. I'm having a massive heart attack. I would go into sudden death that day, go to heaven, come back. And I knew then the call that was on my life was to save my community. And so I put forth the effort to do that.
Hear, hear.
Thank you so much, Tara, for sharing those details with us. I know that's a little hard to follow up on from that, Ponda, but what do you think we need to change to motivate that desire to know those numbers and to keep pushing the envelope when you're being told nothing is going to change and you're fine?
So, first of all, I just want to say, Tara and Dr. Jones, thank you for sharing. That is not easy. And I think, they say knowledge is key. But I say, and I argue that your healthcare knowledge is essential. I think it's important for us to know our numbers, to know your HbA1c, to know your LDL, to know your Lp(a), and more importantly, to make sure that the rest of the community around you, and I think, Dr. Jones, you mentioned this, the rest of the community around you knows your numbers so you can help them know their numbers. Right. We spoke the other day about the sandwich generation.
Yes.
And you and I actually took the time to look it up, and I'm going to read it so that everybody knows, because we talk about this, and it's really important. The sandwich generation is a term that was coined by Pew Research Center. And they define it as recognition that responsibilities of middle-aged Americans are increasing. Nearly half, which 47% of adults in their 40s and 50s, have a parent that's age 65 or above, or are taking care or raising a young child. And a young child that they are financially supporting, or an elderly individual more than 18 years that they're financially supporting. And the reason why I'm telling you about the sandwich generation is that they are very motivated to look after these people that they're looking after, this responsibility that they've now had. And we need to make sure that we're providing them with the knowledge, the empowerment, the advocacy, because they can then help the children that they're looking after or the elderly parents that they're looking after. And then in that way, everybody in the entire community really understands and gets to know their numbers. So, this is something that I wanted to share just in response to your question, Amanda. But again, it takes a village.
Thank you. Dr. Jones or Tara, do you want to comment any further on knowing numbers and how that plays a role in your lives?
Yes, it's extremely important for us to know that. A lot of times folks will say, well, my chemistries, my blood work all looks normal. And I can tell you that in my career, I've had some people who, and Dr. Hildreth can let you know, we used to use the term euboxic, meaning that all your numbers were right in the boxes where they belong. And I've had people that were euboxic that didn't leave the hospital. not because of failure, but because they had catastrophic changes and people whose numbers were all over the place who walked out the door. You got to know your numbers and not wait until the last moment. If you follow your numbers throughout your life, then you can get the trends that Tara talked about. And when something is off for you, don't let anybody write it off. Here's an example. My previous middle daughter, now oldest daughter, was complaining about things not being quite right. And she'd call and I'd say, well, take this to your doctor and take that to your doctor. And after going through this for about a year, they finally did a CT and they found that she had had 4 strokes at 47 years old. And they were not trying to piece together the things that she was saying. And then I had to fly to Kansas City to fight the system to get her the speech therapy and physical therapy and occupational therapy she needed. If we don't, she was able to get an advocate for her because she was paying attention to her numbers. And if the system didn't respond, she had somebody that can help her. We've got to get the folks in our community to know their numbers, and when they're off, not take, let's send you home, it's not covered for an answer.
Yep.
I know most of us saw the black physician that during COVID really documented her death because the system didn't respond to how sick she was and kept calling it drug-seeking behavior. We know that the system is not as responsive to people of color as it should be. So what we've got to do as people of color is to come loaded with information. Take time that when you think of something's wrong with you, make a note. Ladies, carry it in your purse. Guys, keep it in your back pocket next to your little phone number book. Okay, so that you can always have that information there
People still have
when you need it.
People still have
I don't think so.
The guys know what I'm talking about. Every one of them put their heads down. Okay, so just so you'll know. Okay. Now it's on your iPhone, but it's okay. It's the same thing. So, but we've got to do that, and I think that if we get to the point that as a community we know what our values are for our own health situations, then we can demand the response that you deserve, and it won't take a Warren Jones flying to Missouri to get you what you need. And it won't take a Tara having a friend to take her back to the emergency room to get what she should have gotten the first. Anything we've got to make a difference on.
I agree, Dr. Jones. I think when it comes to knowing our numbers, when we're in the community, we have a mobile unit that goes all over everywhere. And so we're in the community every weekend serving and making sure our community know their numbers. We're having discussions. We're pulling up my health charts and going over the numbers there. And there is a disconnect between because when people are going to the doctor, but they don't understand what's in their health chart. They don't understand the LDL. They just hear the doctor say, "You're okay." So we have an opportunity to break those numbers down and go over what they mean and how they connect to your heart health. And so knowing your numbers is where we start the conversation, from blood pressure all the way to A1C that we're doing on our unit. So knowing your numbers is how you save your life, is what we tell them. You know, if you want to save your life, you have to understand where you're at. If you want to change things, you have to understand how it impacts your family. First, how it impacts you, how it impacts the family, and then it impacts the community as an ecosystem, because if we lose one, it impacts all of us. And so that's what we're trying to avoid. And so we preach numbers on the bus. And so we feel confident that when they leave there, they have an understanding of what the LDLC means, what the HDL means, and they can speak to it. So it's important.
Thank you, Tara, and thank you, Dr. Jones. Ponda, as Reggie alluded to earlier, people want to see the doctors that look like them. So can you talk about how we need to increase the diversity in our workforce development and to help solve that issue of not enough black family physicians and cardiologists?
Yeah, absolutely. This is one of our very, very important pillars and something that we're very passionate about at Amgen. And as I keep saying, it takes a village. One of the things we very quickly realized when we created this dedicated team called RISE is that we're going to have to partner with the right community members. I'm really pleased to announce that last year we did our first partnership with the Robert Wynn Award Program. I see you shaking your head, so I know some of our industry colleagues were all in this, but this is really important because we're looking at early stage investigators and medical students with financially protected time and a commitment to really help them get through and understand the opportunities of becoming investigators, because we know that participants or even patients who seek medical attention, they do better when they are being managed and treated by somebody who looks like them, who prays where they pray, who plays where they play. So that collaborations like that are really, really important. The other collaboration I'll share, which we're also very proud of, is for the very first time we have an African American heart study in collaboration with ABC and Morehouse, and we launched this study at the end of last year. But we'll be looking, it's basically an observational study, and we'll be looking and studying the association of Lp(a) increase in African American populations here in the US, and we're looking at about 5,000 participants. And this is the first of its kind, because for us at Amgen, one, we are actually working with investigators and sites that have never participated in clinical trials, and we're bringing the trials to them. So again, I think it takes partnerships. It also takes being bold, and I think we're doing that here at Amgen by really not just talking the talk, but really actioning exactly what it is that we're saying needs to happen here. And those are really two good examples. There's a lot that the Amgen Foundation has been doing over the years to support career development. Like many other companies, my industry peers here, we get involved with internships. We've got some partnerships with Howard. I'm actually really happy to announce that at least two of our last two interns have now become full-time members of the Amgen employees, so we were able to convert that. And it sounds like, I hope it doesn't sound like I'm bragging, but these things are really important, because the more we have people who look like us in the industry, that really plays a big role when it comes to clinical research, the more we can help evolve and change the landscape. And the same goes for our investigators. So that's a couple of examples I can share.
May I add something about the importance of clinical investigators? I was honored to chair the National Advisory Committee on Minority Health at the NIH quite a while ago. And one of the problems we noted back then was that we did not have enough investigators of color. And not only that the awards being given by the NIH to investigators of color were decreasing. Now, this is something Dr. Hildreth talked to us about 10 years ago, how we have to equip our investigators to be able to compete, and we've got a demand of the NIH and other funders that they compete equitably. You don't continue to give the money to those you've always given the money. Because if you keep doing what you've always done, you keep getting what you've always gotten, which is our community being left out of the information. So thank you, Amgen, for setting up. And last thing is, with your African American Heart Study, please couple with the Jackson Heart Study. The Jackson Heart Study is the longest running study of cardiovascular disease in African Americans in the history of the U.S. It's based out of Jackson, Mississippi, and I've been enrolled for 20 years. It rivals the Framingham study, which is the main study on cardiovascular disease. So please see what you can do to pull some of those data. I've given enough blood that you should be able to test something over the last 20 years.
Definitely will.
Okay, thank you.
Thank you.
Thank you, Dr. Jones. Tara, I know when we were preparing for this, you commented that you bring a local physician wherever you are. Do you want to comment on this topic related to seeing those people that look like them?
Definitely. When we're out on the unit, we try to meet our people right where they are. We're not asking them to jump through loops to get to anyone. We bring services to them. And so when we're out in the streets, that's what we like to call it, because we're everywhere from the hood to the boardroom. Wherever our people are is where we're going to serve. And I promise you, it doesn't matter if you're insured, uninsured, no insurance. You need to know where your heart health is, what your heart health status is. And that's even for you doctors that haven't got the LP little A test done. Not calling anybody in this room, but I'm saying you should too know where you stand, because we need you in practice and we need you healthy and well, just like you expect from the community you serve. So, what was the question?
I love asking about you choosing a
Oh,
local.
yeah. So, yes. So we're looking for you guys. We have a Black Doctor Locator, and you've seen a lot of these sites, but we look for you guys to partner with us. We're about to go on a national tour with Amgen, going to all the culturally relevant events, HBCU Classics, HBCU Homecomings. We'll be at Essence. We were there last year. We're going back. Thanks to Cassandra over here at Amgen for coming out to find us. And we take a doctor because it's so important that they see you outside of your coat, that they get to see you without the title, that they get to engage with you just on a street level. And so when we bring Dr. Middleton out or Dr. Sarah Ogen out to the bus, the conversations are great. We'd be like, that guy standing over there with a Howard sweatshirt on with the sunglasses, that's who. They'd be like, that's a doctor? Be like, yeah, go talk to him. But guess what? They're going back to him.
Yes.
And we are driving them. Someone text me yesterday and say, hey, I saw Dr. Farah because of your recommendation. And so they trust us. We are a trusted voice in the community. We have that relationship with our community. The bus is booked all the way to the end of the year, just for word of mouth. We don't have big dollars like most of these organizations. But if you want to see something different, partner with us. We are the change we want to see. We care about our community. We have the numbers. We've screened over 4,000 individuals on the LPA alone. So we know what the data looks like. We just keep it to ourselves right now. But anyway, partner with us. We're going on this tour. Our goal is to screen over 10,000 individuals, and we hope to see doctors at the bus with us as we talk and engage our community.
Thank you so much, Tara. All right, we're going to switch gears a little bit to Dr. Jones and ask you what you're doing in your community to impact Mississippian heart health.
As you know, Mississippi is the 8th most rural state in the country. But yet we're fighting Alabama and Arkansas about who's at the bottom of the health status line. Okay, Louisiana on obesity, they win because of the cooking. But what I'm working with the Diabetes Foundation of Mississippi. We have the highest rate of new onset diabetes in the country. And so as the president of the Diabetes Foundation, I'm working with our team to go church by church, community by community to make a difference. When I was at the University of Mississippi Medical Center, I brought in about $45 million in health disparities funding. And one of the programs I made sure I funded was the Diabetes Outreach Program, so that all the community members knew diabetes self-management and that each church had someone that can advise on how to make sure you eat well, and the guys to make sure that they can go to the barbershop and talk about the good things that need to be done. But working also on heart disease management with my colleagues over at the Jackson Heart Study and the university. But one of the big things I think I feel, if you don't mind my bragging a little, I used to run the state's Medicaid program, and the changes I put in place about wellness 20 years ago are now state of the art. And so I try to go back to the people on both sides of the aisle in Mississippi who still remember me and remind them that they've got to fund the programs that make a difference. And because you can't just talk to one side. And the way I get out of that political pull is I let everybody know I talk policy. I don't talk politics. Okay. So what I need you to do is to go back to your community and engage in dialogues on policy that'll make a difference in your community for the people that look like me. And I think that'll help us immensely. But those are the few little things that I'm doing in Mississippi.
Thank you. I happen to know that list's a lot longer, but I know we only have so much time. So thank you. Ponda, what do you think we need to do better in our clinical research in cardiovascular care?
Yeah, I mean, I think we've spoken a lot about, knowing your number, understanding not just your number, but, multi-generational, the sandwich effect, etc. But I do think that, I think you shared the stat initially that there is a 50% of African Americans have or will have a higher incidence of cardiovascular disease versus any other ethnic group. And therefore, we have a responsibility to make sure that the studies that we're conducting, first of all, have the correct representation. We know of many examples, and I won't go into them, where clinical studies were done in Black patients for high blood pressure, hypertension, as an example, and it didn't work. The drugs didn't work. Why? Because they didn't have the right participant, or they didn't take the time to have the correct representation in that study. So, again, I think, being able to have opportunities like, the Jackson Heart Study, as you mentioned, this African American Heart Study that we're doing at Amgen is really important, because we need to make sure that we continue to find opportunities to study in populations that have a higher incidence or even a higher prevalence for that disease state. So, at Amgen, we're aiming to cut cardiovascular disease by half by 2030. That's a very ambitious goal, but we're going to do it. We want to do it, but we have to do it together as a village and in partnership with some of the members that I mentioned before. So, yeah.
Thank you, including Ms. Tara here.
Of course. I'm getting on that bus soon.
Get on the bus.
All right. Dr. Jones, further to this discussion about cardiovascular disease being the number one killer, what are you thinking we're doing wrong and how we might be able to correct it?
That's a great question. I think the thing we're doing wrong is we haven't gotten a total connection between the healthcare delivery system and the patients to whom they're delivering care. Right now, the system is looking at dollar signs instead of people, and the folks that are going in often aren't going in as prepared. I need to share with you that I've got a birthday coming up in a couple of months, and as my daughter and I were planning my 70th birthday 6 years ago,
So now we know how old you are, right? You got that part, right?
but we were talking, and she was so full of life and enjoyed it. And she was making all of the plans for this celebration in my family. It was important because my father didn't live to be 70. So in my family, we celebrate that. So I ended the call with her the way I always do it, and I love you. And little did I know that would be the last time I'd ever hear her voice. She died of congestive heart failure at 47. And I had known she had some congestive heart failure. I sent her to see her doctor and tell her doctor she needed a pacer defibrillator. Her doctor said she didn't need it, that he would manage her medically. A week later, she was dead. So there's got to be a better caring connection between industry and the patients. And patients have got to demand and not settle for, we'll do it this way. If somebody you trust says you need a more aggressive intervention, believe them. Okay, believe them. And I think the thing we've got to do, when I went to medical school way when the earth was cooling, it was about being a care deliverer. And I think that four-letter word is missing out of our system now. It's called health care. And we're not actually delivering caring. And we got to stop having it be traded on Wall Street and let it be traded on Main Street with compassion and action, collaboration, and family interaction. And when we do that, I think we'll make a big difference in the outcomes. I'm sorry.
Can I add to that?
Yes.
I agree with Dr. Jones. At Black Heart, we're not interested in changing the current system. We're interested in creating a new system. With everyone in here, we have the capability to do that. We keep, I think somehow the translation between this system and where we want to go will never align. And it's like you said earlier, we keep doing the same thing but expecting a different outcome. It's the definition of insanity to me. I think where we're missing when it comes to saving lives and saving families and saving communities is we have to dare to do something different.
Yes.
We have to dare to see it differently, and then we have to act. We talk a lot, and I get clinical research and all those great things, but science it's not saving a lot of us. You know, a 25-year-old athlete just died. My brother-in-law at 38 dropped dead in front of my niece and nephew from a hypertensive heart attack on 3 different medications, but never referred to the cardiovascular doctor. You know, so these are things we're facing in our community. We were in DeRidder, Louisiana. A 32-year-old father has passed away. I watched his daughter point him out in the family picture. We screened his 12-year-old son. This is what we're going through. And so if the science is not going to reach the community, then what are we doing? 4.3 billion in one nonprofit organization goes into research. But how does that get down to the least of these? We are out here and we're dying. So we can't keep doing the same thing. And, you know, we just can't. We can't keep expecting people to come to get care. It's not happening that way anymore. We cannot ask them to get involved in research when even myself, I was just telling Amanda, I don't even know where to sign up. So how can I tell my community to go sign up when I myself don't even know what the steps are to sign up, and then I don't know what those steps look like once I've signed up? So, you know, if it's a decision between me having to be at work and me having to go take care of myself, that's a hard decision for a lot of families. So me having to take care of my family is going to happen first. So you want me to participate in clinical research, you want me to take a day off to get to the doctor. What more do you want from me? And this is not going to save lives. Meeting people where they're at, that's what's going to save lives. We have to get outside of our 4 walls, if that's the church, if that's the doctor's office, the hospital. Get out there in the community and save lives. That's where the difference is going to be made, and that's where the change is going to happen.
All right.
Thank you so much, Tara. It's incredibly important and actually relays into your next question, which is how you want to see your bus in the next 5 years in regards to cardiac care.
I want to see the bus staffed with doctors. I want to see it in every state, first starting with the South. I think we should have 2 buses in every state. I want to see doctors out there working alongside with us. We are here to partner with you. We are driving patients to care, but it has to be doctors that are willing to do things differently. And so I think just having these buses all over and making sure we have that first point of contact. These are not secondhand stories. We hear it firsthand, and we're getting the truth. If you're drinking, if you're smoking, we hear it all on the bus because they're in a very relaxed environment. They're greeted with Frankie Beverly, Marvin Gaye. You know, we know our culture very well. We are our culture. We want to be out there jamming too, but we are talking about serious topics. And so we're coming with mental health professionals. So I want to see all of us connected and engaged in doing things differently across the nation.
Excellent. I think we need to be definitely heading in that direction. Dr. Jones, what is a recurring theme that you're seeing in cardiovascular disease in the Black population that we should be paying attention to?
The current theme that we're seeing is that, as Tara mentioned, the science is not really getting to our community, and the theme of people not knowing the importance of cholesterol management, getting their cholesterol done. You'd be surprised how often I have to tell people they're not going to charge you extra for doing a cholesterol assessment. That's a part of a normal lab coverage for a type of visit. Okay, the doctor's not going to lose money, so they can do it. Okay, it's a part of a typical chem panel, lipid panel. It'll work, but then that information has to come back. How many of you go to see your doctor who has an electronic health record and they have a piece of paper in front of them, and you have to tell them again all of the medicines you're on and all of the different things? The time you're taking to do that is time that they can't spend getting a history from you, doing a good physical exam, and educating. So the theme I see is that the EHR connection between, especially in our communities, is not really functioning up to par. Physicians, our patients need to, I think we're learning to get assessed, but I don't think we're getting the results, and I don't think the results are being explained to us enough. Excuse me, I'm sorry, the pollen up here. I used to live here, and when I come back, it just grabs me when I get off the plane. Oh, I've got water here, good. So I think the theme is of learning about what's going on in cholesterol management. I think the theme about learning about what needing to make sure that we eat appropriately and that we exercise. Something simple. Excuse me. Like if you're in a 3-story building, walk up one flight and down two. If you're within a walking distance of your office, park your car a little farther from the door when you go to the mall. And I know you ladies go to the mall, but don't park it right outside the door. Park a distance away if it's safe. Okay. If you don't have a safe spot in your community, go to the big box store and say, please dedicate a portion of your parking lot where we can come and walk safely. And if they say, what's in it for us? Well, we might shop here afterwards. But these are the kind of things I think are going on in communities of action. And mayors are leading it. So get with your mayor and say, Mayor, I need you to do this. And I think it can make a difference for us. On the medical side, I still think we're seeing far too many people presenting with stories like Tara.
Yeah.
And we should not be seeing. I ran a program at the University of Mississippi for the children and grandchildren of Jackson Heart Study patients, and we found that many of them had higher risk than they should have at their age. And way back when I was doing my fellowship, there was something reportable called M.ED, mature onset of diabetes of youth. Well, now every person that I know taking care of children runs into a child with diabetes in their office every week. And that leads to cardiovascular disease and health challenges. So I think that what I'm seeing in my community is too much of the things that lead to bad outcomes instead of being the solutions. And I think it's incumbent upon movers and shakers like us to get out there and be that voice and demand the platform and use that platform to make a difference.
Thank you very much, Dr. Jones. Tara, do you want to share some of the barriers you're seeing in the work you're doing in your community?
Some of the barriers that we see is making really time, making the time for yourself. We have to really cover. You have 24 hours in a day, and I know many of us are also guilty in this room. You have 24 hours in a day, but how much time do you make for yourself? Can you make an hour for yourself? I see somebody out there. I ain't talking. Just say ouch, like you say in the church if I'm coming down your street. But yeah, we have this. Religion has done a number on our community, if I can just be honest, and I feel like this is a safe place to be honest. If I can just be honest, because a lot of times we take care of everyone else but ourselves first. And so until we put ourselves first, that's going to be a barrier for us as how we care for ourselves. I think caring for yourself starts with you first before we even expect the doctors or anyone else to. And so I think that's the first barrier, is dealing with the behavior behind the why we don't. And so one of those reasons is that we are struggling to find time to include ourselves in our day. So if we can do that and make that change, I think we would be on the start to something good.
Thank you, Tara. Do the people in your communities that you're going to, are they sharing their barriers with you?
Yes, well, we're probably oversharing. There's a lot of oversharing that happens. But yes, so we know, from making time, from it being personal to going to see the doctor, as far as access or knowing where our doctors are. That's one of our biggest problems in our community. We don't know where our doctors of color are, where you're located, what do you do, what insurance you take. And so that's a barrier. Because they're looking for certain doctors, and we want them to see doctors that look like us. Before I didn't have that, but now I have it across the board. I don't see no one that doesn't look like me, because it's a cultural experience that I'm looking for, and a safe space that I'm looking for. And so I think that's the second one, is we don't know where we're located, and so having to find doctors that look like us is a struggle, and we know that some places are just deserts out there. And then I think the last one is making it important to you about family, making it a whole family environment of care within your home. Mm-hmm. And how do we do that? How does the eating look? How does the mental health look? And how does our time management look? So having those conversations, we do a lot of sharing.
Excellent. I'm sure they're really looking to you to share those things with them. Speaking of the deserts, in regard to the African American Heart Study, we are working with a pastor down in Gainesville, Florida. And the moment he heard about that African American Heart Study, he said, Amanda, I've got to go find a cardiologist to add to your site list. And he was on his phone texting in the middle of a conference, all-day conference, and he found out he had no cardiology department anywhere near him in Gainesville. And so, you know, a lot of people are looking to their PCPs to provide them that sort of cardiology care, and they're getting 15-minute scheduled appointments, and what, 5 to 7 of those minutes are going over those medicines that Dr. Jones was referring to that we've already gone over a few times. So the care is definitely missing. So I appreciate you both sharing those barriers. They're definitely across the board. Ponda, did you want to share any closing remarks about how Amgen's addressing this and in response to both Tara and Dr. Jones's comments?
Yeah, first of all, I'm very conscientious of time. How much time do we still have on this panel? Are we good?
Go over.
We are over, yeah, that's what I thought. So I do want to make sure we give others a chance to come up as well. But, you know, I don't want to repeat myself, but I do think that everything that Tara has highlighted and everything that Dr. Jones has highlighted are things that we speak about as an industry, that we speak about even at Amgen. You know, we've had the opportunities to have patient engagement and advisory councils. And, you know, I think the main thing is to come in there with humility, with the ability to listen, to really listen. Listen with the intention to listen, not with the intention to, you know, shove your agenda down everybody's throat. And I think that we've been able to do that very successfully. But, you know, the barriers that everybody has mentioned here are very real. And I personally, you know, we're talking about cardiovascular disease, and we're talking about, you know, advocating for yourself or advocating for your children. That is hard. I mean, I, as a very educated individual, often have to have really hard discussions with my family physician just to get an antibiotic for my son. You know, it's something as small as that. And I do recognize that these barriers are there and they continue to be there. But, you know, we've got to, like we say, equip ourselves with knowledge, know your numbers, and ensure that the rest of the people around you in the community that you work with knows their numbers too. So they can advocate for themselves, so we don't have to hear continuous stories like, unfortunately, Tara has shared and Dr. Jones has shared with their family members. But thank you for the opportunity. I think it's been a great panel discussion. Amanda, I'll hand it back to you to close us off.
Thank you so much. And thank you to these wonderful people for sharing their stories. Hopefully you took away from their sensitive stories something, but also from the work they're both doing in their communities and also what Amgen's doing in the community and out there in the world to try to make these changes. And hopefully you were able to take something away that you can go back and do. So thank you so much.